So let us talk about one of the most common skin diseases called eczema. It is also called atopic dermatitis. This is a disease in which one develops some kind of skin rash with inflammation, with itching, with little bit of scaling, and these patches tend to remain for a very long time. Children may be seen having eczema. Newborn babies or the infants up to the age of 1 year, they may have sometimes very severe form of eczema, which is also called infantile eczema. Some children may have it extremely severe form of atopic dermatitis, affecting the entire body. It may affect more of the folds of the skin, neck, face, cheeks, and it could be very difficult to treat many times. It can affect adults. One fine day, suddenly a 25 years old gentleman or 50 years old gentleman may come up with a patch of eczema. So it can start at any age. It is considered an autoimmune disease. It is also considered immunologically mediated disease. Sometimes it is triggered by some external factors such as exposure to certain chemicals, certain metals, certain contact, what is called as contact dermatitis. But many times it may be because of internal factors. Without having any external apparent reason, one may develop it. And that is because eczema is many times immunologically mediated disease due to genetic factors. So there are genetic tendencies that we inherit in the form of some hypersensitivity, and that could lead to develop eczema or atopic dermatitis. In adults, many times you have seen patients having eczema for many years. They may have very severe form of eczematous patches on the legs or thighs or hands for years together, or may sometimes lifelong, and they may be resistant to treat. It is very important to understand when you are treating eczema that first of all, eczema, it is seen on the skin, but essentially it is not a disease of the skin, as I always say. It is a disease on the skin, but it is because of the internal immunological factors. So the fundamental treatment has to be directed internally to correct, to modify certain immunological infrastructure of the patient in such a way that one becomes less sensitive to internal and external factors and leading to healing of eczematous patch. If you put attempts of treating eczema from outside by the use of immunosuppressant medicines for a long time, like creams and lotions, in our experience, it is not going to help much. It might give you some immediate relief, no doubt. It may give you relief for a few weeks or few months also. But the experience says that such cases of eczema are likely to come back. They are likely to reappear sooner or later. Usually within a few months' time, they are likely to come back. When they return, maybe on the same place or maybe other parts of the body, they are likely to be again more difficult to treat than before. And they may not respond to the medicines very easily. So this is a common pattern that we have seen in the cases of eczema or atopic dermatitis. So the take-home message here is that when you develop any eczema or atopic dermatitis in babies, children or adults, don't try to fix it superficially by using immunosuppressive medicines or measures. Try to understand the cause, the reason behind that internally. And with the right kind of homeopathic medicines, we have seen the results are reasonably good with eczema. I'm using the word reasonably good because we cannot ever claim 100% recovery of every case of eczema using homeopathy or for that matter any treatment modality. My job is to give you a realistic picture based on certain significant experience. Some cases of eczema could be very difficult and obstinate, and they may not even respond to homeopathy. We have seen that. We have seen success and failures both in homeopathic practice while treating eczema. But by and large, the success rate, I would say, is higher than the failure rate. That would be an honest submission. Some cases of eczema may have very severe form of itching or oozing or some kind of discharge, and they might get secondarily infected due to external infection. So such cases may also require certain additional conventional treatment to give you relief in itching or discharge for some time, and that is considered okay. As long as you are not using certain immunosuppressive medicines, it is okay to use certain conventional medicine for symptomatic relief in our experience. So I hope all in all, this information on eczema will help patients and the family members, anybody having eczema in the family. Thank you so much for watching.